Hey everyone, I'm going to teach you how to brush your teeth with braces on while you're in treatment. So we are going to get you a bag after your first orthodontic appointment with us, after we put your braces on, that will have the contents here that we're going to show you today. So we stress brushing while you're in treatment because we want your smile to be absolutely beautiful when you get done. And we want to make sure that we give you the tools for success. So we are going to send you with a sheet that will go over all your orthodontic instructions. What we really want you doing is brushing 3 times a day for 2 minutes each time. We want you flossing every single day as well. And then we also have a food list for you that we will go over to kind of show you do's and don'ts of eating while you're in braces, as well as different alternatives for those. So with brushing, we are going to stress it because we want to show you here how going from good brushing to not so good brushing can affect the outcome of your treatment. So these people here, they have really shiny teeth. They have really healthy pink tissues. Everything is bright and there's no buildup here. As you kind of go down the list, you can see towards the bottom, they may not be brushing and flossing as well. Their tissues are very red, very puffy. Their teeth are dull and gray. There's a lot of buildup there as well. So if you're brushing here, your outcome is gonna be like this one. If you're brushing here, you're gonna have all of these scars. These are essentially the start of cavities and they can progress into that. But once they're there, they never go away. And that can develop from plaque sitting on your teeth. And so that's that like white fuzzy sweater stuff that sits there after you're not brushing very good for a while. And that's gonna eventually, it secretes an acid that sits on your teeth and it starts to eat away at the enamel. Eventually, if you don't get it, it will turn into a cavity. But once those are there, like I said, they never go away and you don't wanna do all that hard work just to come out with scars on your teeth here. So I'm gonna show you how to avoid that. So as far as brushing goes, you can take one of our Meyer Dana toothbrushes that you get in your bag and you're going to take your teeth here and you're gonna brush your biting surface all the way to the back. I want you to brush the inside of your teeth as well, all the way to the back, inside all the way to the back. Now, whether you have an electric or a manual toothbrush, that doesn't matter. The electric toothbrush will do the circles for you. A manual toothbrush, you just have to do the circles. It's all about the angles here. So you're gonna go to the braces and you're gonna go in small circles all the way around the brackets to the very, very back. And then you're gonna flip your toothbrush and you're gonna do the same thing, small circles all the way around the brackets to the very, very back here. From here, you're gonna go and flip the toothbrush up towards the brackets. You need to get underneath. You can see how the bristles are going underneath the wire here and breaking up all of that food and buildup. Now, the number one angle that most people miss and how they get those scars is gonna be taking from here. You wanna flip and go against your gum tissue down towards the brackets. This can be a nice gentle scrub. We don't want you going really, really hard. That can damage the tissues, but a nice gentle scrub will keep the tissues really healthy and it'll break up all the plaque on the top of the brackets there to ensure that you're not getting those scars. Once you have the brushing done, we are going to floss. So you're gonna get some flossers here. You can get any of these products at Walmart, Walgreens, Target, anywhere that's gonna have a dental aisle. This here is nice because it has a plastic tip, and this tip is gonna help you get underneath the wire between the brackets. So from here, you're gonna go down towards the brackets with the floss. That will help get underneath. You're gonna pull it, and you're going to floss the side of the tooth here in a C shape, pull it over and floss the other side of the tooth in a C shape, pop it out, pull it through, and then you'll just go to the next one and the next one all the way to the back brackets there. Sometimes we are out eating dinner with family or friends and then we need to run an errand afterwards and we don't quite have a toothbrush with us. You will get a travel toothbrush and toothpaste to take with you. But we also have what we call proxy brushes. These are really nice to help get the food out between your teeth until you can get to your toothbrush. Another good trick is to swish with water. That will help neutralize everything and break things apart so you're not walking around with lunch in your teeth. These, you can take and bend them to get a better angle, but you just take them and go away from your gum tissue and kind of push between the brackets, and that will help break up all the food that you've been eating until you can get to your toothbrush. Water flossers are nice. They help break up a lot of things on the surface, but you really should be going through with thread floss on a daily basis to really get up underneath those tissues. Sometimes we have things where our bracket breaks, maybe as things are moving, something starts poking, you might get a wire that slips out from time to time, or if we're closing space, you can get pokey wires that way. We are also going to send you with a container of wax. Now, wax is going to be really helpful as you're getting used to your braces. Your lips and cheeks will get used to the braces over the course of a few days, but in the meantime, you can use your wax, and you can use this at any point throughout treatment. One thing that you need to make sure you're doing if you're using the wax is we want you to dry that area as best as possible. You can use a paper towel, you can use a cloth of some sort, and you just want to dry that area. Then you're going to take a small piece of wax from your kit here. And then the warmth of your fingers will help you roll it into a little ball. And then you're going to take the dried area and you're just going to form that wax over top of it. And that will stay there until you remove it. You want to make sure you remove it prior to eating. And then you can replace it when you are done eating. But if you have anything that's pokey, sharp, really causing you problems, give us a call. We can kind of help you troubleshoot it, or we can get you in if we need to help make you comfortable. Now, a big thing is going to be making sure we don't break our brackets. So one of the things that we do is we provide a food for orthodontic thought for you. So that will go through your no-no list to make sure that you're not breaking a bracket. If a bracket is broken, make sure you call our office so we can get you scheduled to get that replaced. But these will help you avoid that from happening. So a couple things: if it's hard, chewy, sticky, or crunchy, we generally want you to avoid it or find an alternative way to eat it. So pop and juice, those are going to be very acidic, just like the plaque on our teeth. And so those can also cause scars if you're drinking a lot of it and not brushing. It's not that you can't have those things. We just want to make sure if you do drink an orange juice for breakfast that you brush right away and don't let it sit on your teeth all day. Another thing is that if it is not food, we don't want you chewing on it. So pens, pencils, ice cubes, sweatshirt strings, blankets, whatever the case may be, we want you to avoid those. Pizza, we would never take away, but we want you to cut it up into small bite-sized pieces and eat it with a fork. And if it has crunchy crust, we want you to remove it. Chips, as long as it's not part of the Edo family, so Doritos, Tostitos, Fritos, Cheetos, anything like that, we want you to avoid. But you can have the soft chips like Lay's, Pringles, baked Cheetos. You can have Goldfish, baked crackers, Ritz, things like that. We want you to avoid hard shell tacos, but you can still have soft shell tacos. Nuts and popcorn are going to be big no-nos because they do break a lot of brackets, and they also affect appliances as well. They're foods that don't break down on their own, and so if they get stuck somewhere, they're not going to go away until somebody takes them. But you can have popcorn as an alternative. As long as you don't have an appliance, you can have sugar-free bubble gum. Otherwise, it's a general no-no. And then we want you to stay away from things like caramels, suckers, fruit snacks, anything super sticky like Skittles and Starburst. Generally avoid those. But you can have like the Hershey's, the M&M's, the Reese's. Cereal, as long as you soak it in the milk for a little bit, it should be okay. We don't want you just taking it straight from the box. Generally, Rice Krispies, oatmeal, those types of things are going to be better. Bagels, those are really chewy and crunchy, especially if they're toasted. So try to avoid those and go with muffins or toast instead. Beef jerky, the strips are going to be way too hard. So we want you to go shredded, ground, or you can have the tiny little soft nougats. Any sort of meat, we want you to cut off the bone and eat in small bite-sized pieces. So ribs, chicken wings, steaks, all of those things. And all of your fruits and vegetables, like carrots, apples, we want you to cut, shred, or cook. We don't want you biting into anything. Everything should be cut up and eaten in small bite-sized pieces. After your appointments, your teeth will probably be a little bit sore as they're moving. That is to be expected. And so for a few days, we want you to take some Tylenol as needed, and we want you to eat softer foods. So things like pastas, mashed potatoes, soups, different things like that will help your teeth feel a little bit better until they're able and not so sore to kind of transition into the other foods that you would normally eat. So if you have any questions or anything like that, please give our office a call.